Welcome to Healthcare IT Today. I'm John Lynn, together with my colleague and friend Colin Hung. The world of technology and healthcare are ever changing in new and novel ways, and that's why we love this stuff. So join us as we discuss the latest healthcare and health IT news, meshed together in new ways which help generate ideas and new perspectives. Plus, we'll have a little fun along the way. On today's episode, we'll be reacting to some of the top health IT headlines. And be sure to follow the show on Twitter at the hashtag HITSM and our personal accounts at TechGuy and at Colin_Hung. Plus, check out our 16 years of health IT blog content at healthcareittoday.com. Man, the headlines have been crazy lately. I mean, it feels like, and it was the holidays. Usually it's boring during the holidays.
Yes, this run up to the end of the year was quite exciting in terms of healthcare headlines. It was unlike anything I've seen before, which is great for us.
Yeah, that's fair. And when you think about the money pouring into healthcare, I think it's not going to go away, right? Like, I think the headlines are going to just keep coming.
I agree. I think we're going to definitely see a big news year in 2022, and not just because of COVID, obviously, which still is in the headlines, unfortunately, but just because of, you're right, all the other interest from other organizations and all the money entering into healthcare. It's going to be a fun year.
Yeah, that's for sure.
So, John, I got to ask you, this is the big one, of course, that came out late last year, Cerner's acquisition by Oracle. Big news.
Yeah, for sure. I mean, there's so many ways to look at this. Interestingly enough, the market kind of reacted poorly for Oracle. They thought for Oracle, this is a bad acquisition, which I thought was interesting. Although for Cerner, their shares jumped. So it was a good outcome for them, I guess. There's so many ways to look at this. Let's start with what matters. What about Cerner's users? I think I don't know. To me, it's going to be much ado about nothing to some extent. I think some will be disappointed that they probably will move away from Amazon's cloud infrastructure and towards Oracle's cloud infrastructure. So that could cause some heartache for some users. But I think from the day-to-day Cerner user population, I don't think it's going to be that much different. Maybe Oracle will initially invest more to solve some of the problems like the revenue cycle management, which has been a focus for Cerner for a while. And maybe they'll really push to solve some of that. And maybe you'll see some initial investment, and then over time, like usually happens in these acquisitions, that they stop investing in the same way. But at least initially, I don't think it's going to be a major thing for most of the customers.
Yeah, I agree. From a customer perspective, I don't expect to see a lot of change from the Cerner user community in terms of operationally or even technology wise. I think they're pretty much on the track they're on, right? Yes, I think I agree with you that there will be a general shift towards Oracle's cloud infrastructure as a way away from Amazon. But at the same time, I think if they were smart, they'd probably allow for both. There's just maybe an incentive to go to Oracle as opposed to, oh, it doesn't work on Amazon, right? Or things like that. But where first of all, I think from a Oracle perspective, I think obviously this gets them into healthcare in a big way. I mean, they were one of the few tech organizations that sort of hadn't made a lot of waves in the healthcare space yet. They were sort of always on the fringe. So this obviously puts them both feet firmly into the healthcare world, and is sort of typical of Oracle's history, right? Where they sort of wait on the sidelines a little bit and then they jump in. So I think it's actually pretty exciting for Oracle, even though I think maybe what the market was recognizing is maybe they overpaid a little bit. Maybe the revenues that they were anticipating from Cerner are not going to be as high as the market believes it will be. But certainly from a long-term strategy, I think it made total sense for Cerner to get in. For Oracle to get into this business.
Well, and what's fascinating about this is that Cerner runs on Oracle. So you have to think that, Cerner customers are one of Oracle's biggest client bases. So in some ways, they just bought their client base to ensure that the success of the future is there for them, and Oracle selling those products into healthcare and having those connections. And maybe they've seen some of the bleeding that Cerner's had to Epic, as far as wins and losses. And they're like, we need to turn this and right the ship, because otherwise our bottom line is going to be impacted if a bunch of healthcare clients, move from Cerner to Epic. So maybe they will invest in that regard to ensure that they continue to buy the Oracle products. So there's an element there that could be interesting. I did hear one person say, though, that anyone that was debating it now, whether they should go with Cerner or Epic, they thought would probably go towards Epic because they're like, oh, too much uncertainty with the acquisition and all that. And there is a transition period that happens, but I'm not sure that's fully the case, but I'm hearing that out in the Twitter sphere, et cetera.
What's interesting for me about this acquisition is what will happen to the Cerner ecosystem. Because I think that's one of the areas that, in terms of degree of change, I think there could be a big change there, right? Because Oracle obviously has their own partner network and ecosystem. Will the Cerner one be rolled underneath? Will you now see some of the Oracle partners now get into the Cerner space, right? And increase the size of the ecosystem and improve it and diversify it. There's a lot of interesting things that tend to happen when an acquisition like this happens. And I'm curious to see what will happen with the Cerner ecosystem, because they spent a lot of time building that over the last few years. Now will all of a sudden that be transferred over to be run by the Oracle partnership group, right, which runs very differently, obviously. So it'll be interesting to see. I think again, over time, I think customers will benefit from this because Oracle's ecosystem is much more broad and much more diverse. And especially when you start looking at the IoT world, I think there Oracle does bring a big advantage to Cerner customers.
Yeah. There's also an international element here that Cerner actually has been doing quite successfully. I mean, they've been having challenges, I think, in the US against Epic, but internationally, Cerner has been quite successful. And if you think about partnered with Oracle, who has their fingers in every single country,
Sure.
and every large organization in every country, that may be the big opportunity for Cerner, is to grow their international presence even faster than they were doing previously. So there is an international element there. And then there's also a data element, right? I mean, I don't think any one of us would say Cerner and Epic are in trouble and that 10 years from now, they're not going to be large companies, right? They will be,
Sure.
right? And so Cerner, even without the acquisition, et cetera, was going to be successful and have a large customer base. And so, under Oracle, they're going to have some opportunities to continue to grow and be successful, and they're going to have access to all that data. And we know how valuable data has become. I don't think we've fully realized that in healthcare, and some of us are scared of what fully realizing value of health data is. But there's an opportunity there for them to be extremely valuable because they have access to the data, and we see that in some of their AI products, right? How do they learn, what they do? Well, now they have access to this treasure trove of data from Cerner customers that they can use to train those AI bots.
Totally hear you. And that'll be interesting to see, especially as the amount of data just continues to grow in 2022, obviously.
Yep.
Moving on to another headline, John, another big one, of course, the recent verdicts that have come down in the Theranos case. Elizabeth Holmes has been in the news for months, and finally we've got the jury coming back, and she being indicted on found guilty at least on 4 counts of fraud. What do you make of that?
Yeah, so the initial reaction from people is like, of course she was indicted on all the ways she misled investors, but she wasn't indicted on any of the ones that were patient. And I get where they're coming from. Like, it is, it feels like patients don't matter, venture capitalists matter, money matters, the little person on the totem pole doesn't matter. But I think that's reading too much into legalese. And so we shouldn't, put our cultural values on what the legal system decides. I mean, we have that happen all the time where maybe some murderer is let off because the way that they captured the evidence was incorrect. And so they couldn't use the evidence, even though it was quite clear that that person was a murderer. And it's awful. It's an awful part of our justice system, but we shouldn't have our cultural values depend on the justice system trying to do those. It's clear to all of us that she screwed over a lot of patients. She doesn't need to be, whether she's indicted for it or not.
Right.
Like, we know that that's the case and that that's uncalled for, and she's going to be held accountable for that. I think, what if it's not in the justice system, at least in the system of popular opinion.
Yeah, I totally agree. I'm not a legal expert. Neither are you. I can't really figure out like why they did or didn't indict on some or come back with a guilty verdict on some and not others. But definitely, I think it was a blow for patients not to have at least gotten some validation that they were impacted. Because I think, unfortunately, the coverage is going to say, well, she didn't mean to impact patients, so they were okay. Like somehow it's okay, right? Like, and it's not, clearly, because people had their lives turned upside down.
Yeah.
And, for the period where they had to go get between the time they got the Theranos test back and the time they got a validation test done, there's all that worry and concern. And, I feel for all those patients that came and told their stories about they thought they had cancer or they thought they were having a miscarriage, and, only to find out later that it, through another test, that it wasn't the case. Right.
Yeah.
But yeah, I mean, obviously this is an indictment of fraud in the sense of, completely, there's one thing to over exaggerate or overstate your capabilities. This got into, like, just reading some of the transcripts and some of the coverage. I mean, it was crazy, right? Like, you look back on it and go, like, how, when you have like so many people telling you this didn't work, and yourself that you had to use another company's machine to even produce their test results because yours didn't work. I mean, how can you continue to go on and saying that yours was the best, right? Like, that is just, to me, it's an indictment of that. And thankfully, the verdicts came back to say, yes, at least they found her guilty about those things.
Yeah, and she'll have to pay some price for the choices she made. I mean, not to justify what she's doing, because she deserves the punishment of the choices she made. But when you read the pressure she was under, it gives some understanding of why someone could make a decision that you and I, looking back and Monday morning quarterbacking, look at it and say, how could someone do that, right? And when you see the pressure she was under and the kind of world she was living in, it makes at least a little more sense, right? Like, she's still accountable for it, and she should be, right? But at least it makes some sense why. The other reaction for me that was so interesting to see was how many women said, thank goodness, she needs to be held accountable. She's put women back in entrepreneurship further back than any men ever did. That was a tweet I saw from one of the women entrepreneurs who was like, good riddance, right? You screwed a lot of women that, now, VCs don't trust us, et cetera. So that reaction was interesting for me as well.
Yeah, hard to argue against that, right? Like, I think she set back a lot of different groups, women,
even the
entrepreneurs.
testing.
Yeah, like, blood testing in general, biotech startups, right? Now everyone's going to look over look at a company and kind of go, are they the next Theranos, or are they the next Google, right? Like,
Yeah.
it's that's always going to be in the mind.
Isn't that kind of healthy though, right? I mean,
people should be looking at it, but I don't think people go into investing looking for fraud. Like, I don't think that's the first thing on people's minds when they're making an investment. I think now, given the high profile of this case, I think now there's going to be a lot more scrutiny around that, right? And I think again, in the long term, it would be a good thing, right? But certainly in the short term, I think there's a hefty skepticism around this type of technology, even though some of the technology may be helpful, right? In very sort of narrow use cases. She set those companies back decades.
Yeah, for sure. I've heard from one that said it basically, that no one trusts us what we're trying to do because of Theranos. They have a huge bar. And I wonder if this is why so many health IT companies are funded outside of the Valley, because her thinking and her mindset is the Valley mindset of, and it really started with Steve Jobs and some of those early ones, right? I think they call it the reality vortex that he creates. That's like,
that's right.
That created amazing results, where it wasn't expected. And so trying to do that in healthcare just feels very different. So is that why Kansas City has Cerner, right? And Verona, Wisconsin has Epic, and there's a number of them in Boston, Meditech's in Boston, et cetera. Yeah, I mean, that they're coming from non-traditional places because that reality vortex, Silicon Valley, break it quickly, fail fast, just maybe doesn't work quite the same way in healthcare.
It might not. It might not. I mean, for me, I think that this as the story broke and as the news started to come out, what was fascinating for me about this whole thing was just how many bubbles there were, bubbles within bubbles, right? There was sort of Elizabeth Holmes living in her own reality bubble of, hey, like I can do this and I believe in the technology and we can make this work and just give us enough time and money and et cetera, right? Then there was the bubble of the investors, right? Like just how the
Yeah.
investors got duped. And then there was the bubble sort of, around I'll call it herself in the terms of, to your point, John, the pressure she was under, the personal situation that she had, right? And that bubble I don't understand, like I can't imagine.
Yeah.
And then there's the Silicon Valley bubble, right? The where that sort of created this environment where it was so results driven, where it's results at all costs, right? Which drove her and others in that company to make those very, very poor decisions, right? Which in the light of regular society, right? Or anyone outside of the Silicon Valley bubble look at us and go, that's just crazy, right? Like, why would you make those decisions?
Yeah.
But when you're in these bubbles, it is very hard, right? Like we were on our own bubble, right? Of health IT. Like we're very
Yeah. It makes you
positive
wonder
of,
what bubbles we're in, right?
right? And that was, to me, that was the most fascinating part of this, right? And if anything good can come out of just sort of observing this would be, what bubble am I in, right? Like what bubbles do I exist in that maybe I need to explore and get out of? Because it became very clear that she was in multiple bubbles that were not really connected to reality.
Yeah. I wonder about the employee bubble. I haven't seen that one as explored as much. And I'm sure there were people calling, crying wolf and not being heard, et cetera, I'm sure. But I look at it also, what is challenging about this situation, it was how much we wanted this to be true.
Sure.
Like, and how that drove the narrative, whether it was the press, whether it was the venture capitalists. We wanted it to be true that just with a simple blood stick, you could do these complicated labs. Like we want it's insatiable, as opposed to, the next social network, that's not insatiable. Whereas this could actually impact so many human lives and would transform the healthcare industry that we almost wanted to will it into being because it was such a desired outcome.
No, you're right. I mean, I think, at the beginning, we were all hopeful, right? Like when we heard about this technology,
we still are, right?
Yeah.
Like we still
those of us insiders still are. It's just I think no one's going to fund this for a while. But yeah, I mean, we all hoped that this was correct. I also would liken this. I would lump uBiome into the same category, right? With a single analysis of your biome, you could figure out whether or not you had a predilection for certain diseases or had a current condition. We all hope that these are the cases because we know when you're able to detect something early, you're able to cut costs and recover, right? Like, so we all want this.
Yeah.
Unfortunately, yes, in both those cases, it ended up being the technology was a house of cards.
Yeah. And we're seeing the value of this, right? I mean, whether it's, the AliveCore EKG and being able to understand it, or the continuous glucose monitors that are out there for diabetes, we've seen the impact of having the right data available quickly. My friend just sent me his son's continuous glucose monitor screening. He's like, I can see my son's glucose at any moment of time. And it's like, how beautiful is that? I know at the CES conference, Withings is announcing a new scale that actually has a 6-lead ECG on the scale. And it's like, so people are innovating in this way to get the data that we need that's medically relevant. And so we really want this, but unfortunately Theranos was a bad example that set back a lot of the efforts.
Hey, if you're just tuning in, you're listening to Healthcare IT Today with John Lynn and Colin Hung. Today, we're reacting to some of the top healthcare and health IT headlines that have passed our desks over the last couple of months. John, let's switch topics a little bit. Something totally different. Ransomware. and the big outage that was caused by Kronos being hit by by their ransomware attack.
Yeah. What's fascinating about the Cronus ransomware incident is that it crossed industries. Like, I mean, Kronos is huge everywhere. I mean, I remember checking into Kronos when I was working an hourly job, right? You had to be there. You couldn't do it 5 minutes before, et cetera, et cetera. But
Right.
so, it's in so many industries, but in healthcare, it's just huge. I mean, we see that when we go to the major health IT conferences, Kronos has a big presence. And so the fact that the ransomware happened is just impacting so many of these hourly workers, which is the unfortunate part. How do they track it and what are they doing? I saw one organization, one hospital system that put up a form, basically a digital form to replace the whole timekeeping, at least like let us know what time you're working, right? And had their ID and whatever. Certainly wasn't as a solid a solution as what Kronos offers, but they were just trying to survive. Other ones are just paying past checks and then say, hey, we'll reconcile it later and figure it out. But man, what an impact to have. And the other impact is the question of the cloud. So this was an issue of the cloud ransomware incident that everyone had relied upon the cloud. And now we're seeing the downstream impacts of that investment in the cloud.
Yeah, I think, for me, what was fascinating about this story, I mean, we know ransomware happens. I don't blame Kronos for that part of it. However, what struck me about this story that stuck out for me was the length of time they said it was going to take to recover from this. It was weeks. Like they say they could be down for weeks. And I was like, man, that like you should have been more, like I felt like you should have been a little bit more prepared for this. Like, what about your recovery? I mean, if a tornado hit or a hurricane hit, I'm sure you'd be up and running back in a few hours or maybe a days or so. But when I saw the word weeks before they recover, wow, that's a severe incident. They clearly weren't as prepared for it. The other one, of course, yes, was the scope, as you just mentioned, just in terms of the number of people impacted by this singular attack, right? Because Kronos is everywhere and it is cloud-based. So yeah, I mean, it just showed that with that area of operations in particular, there was an acceptance that this was the way to do it, like to just farm it out, do it on the cloud. And yeah, you heard all these stories about people having to go back to manual punch cards and tracking this stuff manually. There was no backup to this, right? It wasn't like people had a backup plan to say, okay, when this happens, here's an alternative. No. They had to create a form. People are doing this manually. It was crazy to try and track all these hours.
I have to say it was fun to put the card in and have it, like, so maybe I wonder if anyone's done that and they renamed it Chronos System or something, but it's interesting though, to your point, it's like how damaging it was and how unprepared they were. And I think there's a lesson here for healthcare organizations that, if they had implemented proper backups and proper, et cetera, you'd have to think they wouldn't have to go that far and they wouldn't be down for that long while they dealt with the ransomware incident. And so that to me is the lesson for all healthcare organizations. What is your business continuity strategy? How are you approaching backups? Are you able to restore those backups and testing all of those? I mean, we heard them through things like Hurricane Katrina, those, but it's like ransomware could happen to anyone at any time. It's like the natural disaster that could happen in any situation, regardless of where you live. And so every organization needs to think about that. It also brings up the interesting question. I would love to see the business associate agreements for all these healthcare organizations and how they vetted the Kronos cloud solution. And I bet there's a number of CISOs that are looking at it and saying, man, maybe we could do better at understanding the business continuity strategies of these cloud providers that are providing for us and understand in detail how they're doing it, because we don't want to have this downtime again. And I would say it's not just the weeks downtime, but I would say the real issue with Kronos is they don't know when it's going to come back, right? Like, right. They're like, but they knew it was going to be at least weeks. And when you say that, you're like, so you really don't know because you didn't have a proper strategy behind it. And so, I wonder if a lot of healthcare organizations are reaching out to their business partners and saying, wait, let's dive a little more in here and make sure that you're doing stuff properly. And I know there's companies like Sensinet that help in this process of kind of vetting and understanding third party risk. And I think they're going to be the big winners in these types of situations, because that way, if Mayo Clinic has already done a third party risk assessment for Kronos, well, then maybe this rural health provider can benefit from that and just layer on top of it.
Right. Right. I just feel for any of the frontline workers, obviously, who were impacted by not being able to get a paycheck or getting a paycheck for a lesser amount because no one can figure out how many hours they worked. Right. So I feel for anyone who's impacted, obviously, on the front lines, who use Kronos for their paychecks.
Yeah. And the expense. I mean, I just feel bad for all those payroll people. It's going to be miserable.
It's going to be a miserable few weeks. John, we can't end this episode without at least talking about the return of a topic we hoped we did not see in the headlines anymore, but that, of course, is COVID. It is back, and it is in the headlines with the Omicron virus variant spreading across the countries and around the world.
Yeah, I mean, obviously it's a little different this time because we have 10 times the spread, but the damage is a tenth of it, or whatever the numbers are. I don't follow it close enough to know exactly, but what's interesting is that mass still means that thousands are impacted, hospitals are overwhelmed, elective procedures are being delayed. I think what's going to be interesting is to see how did healthcare organizations respond the second time. Like the first time we were all just scrambling to survive, right? But now, how many put into place things like telehealth, which helped to prevent overwhelmed EDs, or screening processes that did the same thing, right? To be able to avoid that overwhelming, flow of people who really don't need to be there, but because they're there, you have to see them. So I wonder how many did, and then on the other side, how many didn't, right? And so I think there's going to be some important lessons for us to look at as we see, okay, with this second surge, if you will, or this increase of COVID, how many prepared and were able to weather it in a better way, and how many didn't?
Yeah, for me, first of all, feel for anyone who's impacted by Omicron or who's suffering from it. Even if they didn't end up in the hospital, it still hits you and you're out for a few days. Thankfully, it does seem to be less severe. There's not as many stories about people ending up in the ICU because of this variant, but because of the contagiousness of it, like so many more people are getting it.
Mm-hmm.
For me, what's interesting is the lack of data that is coming out in terms of who is actually ending up in the hospitals, right? Like I know last time we started to get the second wave, we started to get data around vaccinated versus unvaccinated and the impact it was having. So, hey, like if you want to get vaccinated, you'll increase your chance.
Finally, the breakthrough cases. And we've seen that 25% breakthrough cases here in Nevada versus before it was 5%. So,
right. But in terms of I guess for me, we've been in Omicron now for a little bit and we knew it was coming. Yet we're not seeing, at least I'm not seeing a lot of data around, okay, well, we're seeing some data around vaccinated versus unvaccinated. But of the cases of the ones where it was a breakthrough, what were some of the other things that maybe helped contribute to that? Was this all because of family transmission? Was this all because of X or Y? Because right now I feel like we're fumbling in the dark again to go, okay, well, yes, I know we're going to get it, but where are people getting it? And why are these people ending up in the hospital, whereas these people are not? Because I will do the things that try to keep me out of the hospital, right? Right now, we're all operating blindly again, right? We're just shutting down things. We're going back to what we did in the second one. I thought by now we would be a little bit more precise, right? To say, oh, okay, you know what? It's airborne or it's not, or you know what? It happens at restaurants or it doesn't, right? Anyway, I thought we would have learned by now.
Yeah, the lack of testing is missing. The tracing it feels like the tracing is impossible because of how it's spreading. The thing that disturbs me is that because it's so widespread, we're going to have doctors and nurses out because they get it at some place. And so that's going to cause strain on our healthcare organizations. I mean, we saw that. I heard someone predict that for the schools. They're like, whether they shut down the schools or not, there may not be the teachers there to actually run the schools. So, we may not have that choice. So I think that is going to be a challenge for all of us to run through. I mean, I go back to how lucky we are that we work remotely and we sit in our home and we're somewhat protected and shielded from it. And I think about all those people that were forced back to the office. How many employers, went and said, okay, back to the office. And now you're like, no, I don't really want to. And there's going to be a battle there. And I think that's unfortunate because remote work we've learned is possible and can be done for pretty much almost everything.
Yeah, if the impact of Omicron on the airlines is any indication, we're in for some interesting economic disruption. Not because people are forcing X or Y or anything. It's just because you know what, you're sick, and I can't come. I don't want to come to the office because I don't want to spread this to other people.
Yep.
So yeah, I mean it's crazy how many flights have been canceled already. There's shortages around even logistics, right? Like shipping companies and things like that. And we've already heard some of the hospitals going, yeah, we're suffering from 20% less staff just because they're out and having to recover from Omicron.
Yep.
Hey, listen, thanks to all of you who've tuned into this episode of Healthcare IT Today. You can find out more details about our show by checking out the programs page on healthcarenowradio.com. And please share your voice and engage with the community at healthcareittoday.com and on Twitter using the hashtag HITSM. I'm Colin Hung, along with my friend and health IT collaborator, John Lee. Thanks for listening, and have a great week.